Well, it's the latest way smartphone apps are making our lives easier, helping people get wound care. In tonight's Health First, WECT's Ben Smart sat down with the CEO of the wound care smartphone app. Ben, the company has found a real need for apps like this, especially in the prison system.
Yeah, Fran, getting care from a wound specialist can be costly with your time and money. The CEO says specialists don't always make it to prisons, and 2 guards have to go with the inmate if they travel to a hospital. For people with diabetes, pressure ulcers, and other chronic conditions, this health care can mean life or death. That's why the founders of My Wound Doctor created their app. CEO Dan Hannigan in Wilmington and his business partner, a plastic surgeon, started the company in 2015. Now, here's how it works. A patient snaps a picture of their wound on the app and uploads it through the app. Then their doctor or the app's healthcare team in Nashville remotely can access the wound. They send back treatment instructions and ship a box full of supplies to your house. The CEO says it's convenient and personalized healthcare.
So I see that as still maintaining that human element, because somebody's actually looking at you, having a conversation, or they're communicating in your own language back through an app. So they're not just giving you stock answers, they're actually reading what you've said and they're communicating directly back to you.
And if you want to use this app here in North Carolina, a doctor can sign up their practice to use the app. It's not yet licensed for direct patient use, but the CEO says this will likely be available coming this fall. It's available for Apple and Android smartphones in both English and Spanish.
The Wilmington-based CEO is making healthcare just a tap away. A smartphone app is bringing wound care right to the patient's palm. WECT's Ben Smart got an inside look from the CEO today. Ben, this app can help patients get a personalized treatment plan from a doctor in less than 30 minutes.
Yeah, Fran, it's quick and it's personalized. The app is called My Wound Doctor. It's 3 years old and is now being used to help people in major hospitals, prison systems, and from the comfort of their homes. The smartphone app, My Wound Doctor, helps patients needing wound care get quick access to a specialized health expert.
Sort of a self-serve model. The patient can take a picture, send it to us. They can give their phone or give the app to their spouse or their caregiving son or daughter, who can take a picture of the wound, and then we can communicate directly with them as well.
Chronic wounds like those from diabetes and pressure ulcers, but also more immediate wounds that are not life-threatening. So let's say I'm mowing my lawn and I burn my hand on the muffler of my lawnmower. This is my wound. What's the first step I do to get care through the app?
The app will ask you to simply take a picture. We then just isolate the wound itself so we know exactly what we're looking at, and then we send it. That is now going to our clinical team in Nashville, and they're reviewing the wound. Once we see it, we say, here's what you need to do. And that's all through the app. You get a supply pack of things that are needed to take care of the wound.
Inside the box, shipped to your house, gloves, antimicrobial soap, gauze, and more to clean and patch up your wound. And how long does it take from the time that I send in the picture of my wound to whenever I get the advice back on my phone?
Normally, depends on really on our contract with our customers. If it's a direct patient, we would probably respond usually no more than 4 hours after the picture, but we have contracts where we're contracted to support within 30 minutes.
Today, the app is licensed in almost all 50 states, used in major healthcare systems and about 40 prisons.
It's not the easiest thing in the world to get a specialist to go into an infirmary in a prison. Probably not the work that somebody would like to do, but on the other hand, they need that sort of expertise. And so we've been fortunate to have, I'd say, probably 4 of the top companies in the country that support prison health care are contracted with us.
Patients getting personalized wound care with just a few taps and snaps. And the app is available to download now for Apple and Android devices, but there are some restrictions based on where you live if you can use the app. In North Carolina, and a doctor can sign up their practice to use the app, but the app is not yet licensed for direct patient use. The CEO says this will likely be available this fall.